Hi guys, here's Paula, the crazy ozone lady from the internet, and please don't take anything in this video as medical advice. I wouldn't. So here I want to talk about the risks and complications of rectal ozone insufflations. Now, for those who are not familiar with this term, rectal ozone insufflations are exactly what they describe what they are. So basically, ozone gas is inserted rectally into the colon. Now, ozone therapy dates back to 1870, and rectal insufflations are a pretty established part of ozone treatments. So, for example, it seems that especially in Cuba and in Italy, rectal insufflations are quite popular, and they're being used by medical doctors and also applied in professional medical settings like in hospitals. There are reports that there are quite some success rates with treating diabetes, autoimmune conditions, or using ozone in conjunction with chemotherapy or radiation. Especially Dottoressa Margherita Luongo in Italy, she has experience in combining rectal insufflations with chemo and radiation, and she says that rectal insufflations are able to mitigate the negative side effects of chemo, and they can also enhance the effects of the conventional cancer treatments. Rectal insufflations are quite popular. They're used very often. Many doctors and practitioners actually instruct their patients how to perform rectal insufflations at home because they're deemed as being pretty safe. Still, me personally, I'm not a big fan of rectal insufflations, and I'm gonna explain why. So, one of the reasons is I actually alluded to it in my latest article about oxalates and ozone. One of the reasons is that we simply don't know the effects of rectal ozone insufflations on the gut biome. And there's reason to believe that one has to be very cautious when it comes to the good bacteria that we have. So, for example, a recent study found out that people who used to take antibiotics, they're at a higher risk of developing kidney stones later in life. And this is most likely because the antibiotics killed off some of the oxalate degrading bacteria. And we don't know whether it's also true for rectal insufflations or not. What we do know is that ozone can essentially kill any bacteria, any virus, fungus, any bug. It can essentially kill any life form if the ozone concentration is high enough or if the exposure to the ozone is long enough. And so there's no reason to believe that it would not do the same to colon bacteria. And it might be challenging or maybe even impossible to repopulate the gut as it was before. And the ramifications of that are simply still unknown as far as I know. So this is something that I personally prefer to be very, very cautious about. Now, another risk that is, in my opinion, extremely rare, and there have to be special circumstances present for that to occur, is a colon rupture. So in the past, I believe 12 years, I think I heard about two cases where a colon rupture happened because of rectal insufflations. But after consulting with people from the medical field, I've been told that in order for that to occur, the colon walls had to be already extremely weakened. And in such a case, really anything can lead to colon rupture. So even the insertion of, let's say, water during a water enema could have led to a rupture. The risk is that many people who treat themselves at home, they may not know the state of their colon. So someone who's been chronically sick may actually have extremely weakened colon walls without knowing this. So this is something that one should be aware of. And also be aware that a ruptured colon is a medical emergency. So this is something that is very, very serious. So if you have any indication, any suspicion that your colon might be in a bad shape, maybe better to lay off the rectal insufflations and maybe better to consult with your doctor first. Now, another thing that's not so rare, that's painful bloating and cramps. And this is one of the reasons why I don't like doing rectal insufflations at all. And so actually when I have women inquiring me about rectal insufflations, I try to steer them away to vaginal insufflations. And I think as women, we have this huge advantage. And I think that the vaginal insufflations actually offer many of the benefits of rectal insufflations without many of the downsides. So I believe a vaginal insufflation that is performed long enough and in a continuous fashion, that one can achieve a saturation of the lower abdomen, and that the effect of that on the colon is similar or even maybe bigger than with the rectal insufflations, but without the cramping, without the bloating and the pains, without having to deal with feces and all that mess. And there's also no risk of rupturing anything, because if there's any excess gas, it will simply leave the way it went in. So I think as women, it's always best to first go for the vaginal insufflations, and only if this does not give the benefits that one hoped for, to go for the rectal insufflations. Another thing that I've observed, and that some other ozone experts mention, is the fact that the female genitalia have a connection to the lymphatic system. So the ozone insufflation can actually have a systemic effect through the lymph. Now for men, what I suggest is that instead of rectal insufflations, to try a combination of things, and that's drinking ozonated water, taking Oxy-Powder or Homozone, and doing ozone saunas. And during the ozone sauna, what one can do is cupping. So basically one places a cup over the abdomen, and there is ozone gas flowing through the cap, and the ozone gas can be absorbed by the skin. And in the ozone sauna, the skin is moist and warm and it's open, so it can welcome the ozone, so to say. And I think this is a way to saturate this and treat this area through the outside. And I think this might be actually a better solution than doing rectal insufflations. Now, if someone absolutely insists on doing rectal insufflations, what I suggest is to keep the volume limited. So to not use more than 100, 200 or tops 300 milliliters at a time. Because in such a case, I would assume that the ozone gas mostly stays in the lower part of the colon and the rectum and doesn't travel far up. So if there's any damage happening to the microbiome because of the ozone, then it will be only limited to this small section. So I think, yeah, this is probably the best approach to rectal insufflations, to just keep the amounts limited. And what one can do instead, one can do several rectal insufflations in one day instead of one big one that would saturate the whole colon. I think it is better and safer to do several smaller ones instead. That's my take on rectal insufflations. Let me know what you think. Also check out the description below the video. There might be some additional information. Thank you for watching and take care.